Good evening, everybody, and welcome to the University of Buckingham's Great Minds series. This is the 8th, and if you are this is the first one that you've joined, a particularly warm welcome to you. The audience is made up of University of Buckingham students, University of Buckingham staff. It's made up of local community members, and tonight's talk given by Michael Dooley, who's been an NHS consultant gynecologist for 25 years. He's going to tell you all about his own career in his talk and his slides. So I won't do it other than saying that he has many, many aspects to his career as a medic, which makes him particularly interesting, including being involved as a gynecologist on 3 Olympics, including a very prominent role in the London Olympics of 2012. He is celebrated for his work in Poundbury, which he'll tell you more about, which has been involved with Prince Charles. And is interesting because he's a very thoughtful senior member of the medical world who takes a great interest in natural healthcare issues. So Michael's going to be talking. For those who are new, can I just say that do have questions. We've already had a question asked, and do put your names on it. And the earlier you get your questions in, the more likely I will be to be able to ask the questions. Michael Dooley, it's a really great honour to have you talking to us tonight. The series is all about challenging received wisdom. We have far too much conventional wisdom, status quo thinking in our world. That's part of why the University of Buckingham was set up, and it's very much our defining characteristic as an academic institution. Michael Dooley, tell us about how the world is going to be changed by COVID and should be changed by COVID.
Thank you very much, Anthony. Thank you so much for inviting me and giving me that very kind introduction. I feel embarrassed, and yet I'm just a humble gynecologist. I'm not an academic. I'm definitely not an expert in COVID. But what I want to share with you today is my views, how it's changed my practice. And if I can have the first slide, please. You go on to the second slide now. So thank you, Anthony. And Anthony, you and I met. We were at that conference at Dumfries House in Scotland, the Scottish residence of the Prince of Wales, when he set up this conference on the role of harmony in education and harmony in health. And it's from that I've really developed my thoughts and how I feel that from COVID we can learn so much about not only society, not only about how politics can be played, but I'm looking at the level of the patient, and it's really just a potpourri of thoughts, and which I like to share with you. Next slide, please. But before I start, I just want you to look at this sentence, and I want you to look at how many F's are there. How many F's do you see? Now, normally if I was an audience, I'd be asking you to put your hand up and you say 3, and the majority of people say 3. Some people say 4. Some people say 5. Rarely we get the right answer. Next slide, please. Well, if I just put my hand up and I want the next slide, that's probably easiest. Is that okay? You can see there's 6 F's. And the purpose we put in this slide up is to say, I'm not talking anything new. I'm not talking anything revolutionary. It's around us already. And we just need to piece it all together. It's a bit like a jigsaw. All the bits are around the ground, and we now need to get them all together and work in a much more unified and perhaps harmonic way for the future. But why have I become interested in harmonic approach to medicine? It goes back to my father. My father always used to challenge the norm. He was a doctor from a generation of four generations of doctors. He used to challenge it. He worked with Alexander Fleming on the introduction of penicillin, but he'd make me always look outside the box. And during my youth, I was very much involved with animals and breeding animals and farming from other connections. And it was from this that I saw that we treat animals sometimes in a much more holistic way than we do humans, and how stress can affect animals in different ways. And one example I always give is how one chicken farm that I used to know, if the fox was around, as there was thunder and lightning, just that stress would have a huge negative effect on chickens and the number of eggs they're producing. But then, as Anthony said, I had the privilege to travel as team doctor to Sydney and Atlanta and then Sydney Olympics, and senior doctor to the gynecologist to the London Olympics. And I suddenly realized that how we treat our athletes and how we help them look for gold medals should be perhaps how we should be treating our patients. And these are sort of the 5 rings of the Olympics, that it's attention to detail, looking at diet, looking at education, looking at clothing. When we went to Sydney, looking at the sleep pattern and which way we went there, not to upset their melatonin. Also helping them plan their journey. And I think also that's so important, it's setting goals, because everybody had different, everybody thinks athletes go to the Olympics to win gold medal. No, they don't. They may go to their challenge maybe this year to get into semi-finals. In 4 years' time, they'll be looking for gold. So different goals for different people. The role of teamwork and self-help. And the belief of and role of the mind was so important. And while I was there, we had a huge campaign to introduce sports psychologists. But also keeping it very simple. And life, we can make things very complicated. But I think sometimes keeping it simple is important. But going back to the question, can COVID teach us about how medicine needs to change? Does medicine need to change? And I think there are several ways I think it does. That we are getting a huge demand on the NHS services. We're living longer, but sadly, I think we may be living longer, or are we taking longer to die? That are we perhaps not looking at the old age as we should be? Are we spending too much time in the hospitals, and should we be looking at the role of community? And with acute work and acute hospitals getting more specialised and complex, can we do everything everywhere? So medicine may need to change. Next slide, please. And also, we're living in an unhealthy environment, an unhealthy population. And this may be one of the big things that we've seen out of COVID. We're increasing age, increasing obesity, chronic ill health, moving all the way down the road of homelessness, poor education. And the one thing I think COVID has taught us is the huge social divide that is in the past, in the present, and sadly will be even more in the future. And we're also looking at unhealthy population, looking at global warming and environmental pollution. Next slide, please. But so what was my day, very briefly, before COVID? It was traveling. And I worked out in a weeks of my work, in order for me to travel to the hospitals, to the clinics, for my patients to travel, for the staff to travel, per week, over 60 hours of traveling time was required just to sort of service my practice, which seems incredible when you look at the effect on the environment, etc. We just had face-to-face consultations, blood tests, planning treatment, operations, and meetings weren't like this. They were face-to-face. Education like this was face-to-face. So that was the old way. Next slide, please. But before I answer the question, and I feel, Anthony, it's a bit like me writing an essay, how I have to answer my question, make sure I have answered all the points. What is harmony? And I think that's where a lot of people get confused. What is harmony? And it goes back to, next slide, please. When I'd spent some time working in Southern Ireland. And at that time, this was in the sort of early 1980s, there was a new management of labour called the active management of labour. And I couldn't understand what it was all about. It was introduced at the National Maternity Hospital in Dublin. I couldn't understand what it was all about. And I read books about it, and I couldn't understand it. So I eventually went to the hospital and spent a couple of days working there to see how it worked. And I suddenly realized it was nothing new. It was nothing complicated. It was what we were doing, but just a few tweaks and tweaks there. So I was looking for some complicated issue and to solve how management labour was. And we were doing it, little tweaks there. And perhaps that was harmony. It's nothing new, it's nothing revolutionary. And what has COVID taught us? So next slide, please. So what do I think harmony in health and well-being? Before I go into how COVID has affected us, well, harmony to me is going through all the letters of it. H, using history in order to help learn. From the past, we can learn the future. Looking at the role of happiness. And I'm going to go through each of these in individual examples. Look at the active mind, both activity, both in the mind and the body, and then acceptance. Look at R, resilience, reflection. And I think also reviewing all the options that are available to people obtain and maintain good health. And then looking at M, medicine. Is it beyond pills and procedures? And has COVID taught us that? Has the importance of the membership of society, that we need to help burn out inequalities, look for equal opportunities for all. We've got to look outside the box. We've got to look at the role of nature and then eventually give patients the options and their choice. Next slide, please. So let me go through each of those and how I think COVID has affected and may help change medicine. And there may be a silver lining to the cloud. That, let's take history and happiness. We've got to respect the past. We've got to build the future. And I always go back to my early, next slide, please. My early, sorry, and the next one. My early days as a medical student, I was taught by one senior consultant, said, Michael, he said, in medicine, you've got to be like Socrates. And I couldn't understand. I said, why have I got to be like Socrates? And he said, Michael, you've got to know that you don't know. And that is probably one of the big things that has come out of COVID. We don't know. We don't know how it developed. We don't know the spread. We don't know, can we get natural immunity? We don't know so many things about it. And that, is what Socrates says, what the Dalai Lama says. And that's probably the big thing that I've taught about COVID is it's reinforced my views about medicine that we don't know. And that is the simple answer. That's why Socrates was executed. Next slide. And then, as George Bernard Shaw said, and in my opinion, my life belongs to the whole community. And this is what COVID has taught us, the need for good community, the need for good community spirit. People talking about, and not talking about, making their own PPEs or making PPEs for other people, looking at the vulnerable patients, volunteering to go into the hospitals. So the role of the community has become so important, and we've learned that from history, we learned that from COVID. Next slide, please. But also, I always think all my life's a spiral. What we did in the past will often come round and be back in the future. And in the past, the old doctor would do the home visit, and that's gone. So then we did the patient visit to the clinics or the phones. But now you do Zoom calls or Microsoft Teams. So you feel part of the environment of the patient. And it's the new home visit. You don't get as much information from speaking to somebody on the phone as you do seeing them, learning their body language. So we've gone round and perhaps now people will not be traveling to see me. I can see 80% of my work will be continued as a Zoom visit because of COVID, but people are accepting it. And I think before there wasn't the acceptance to do Zoom calls, etc. There was the expectation to come in, but this cuts back. I can do a Zoom call, spend half an hour with a patient, and a lot of my work is with infertility couples, and you have the couples there, but it's their own home. half an hour and then they can get back to work instead of the 3-hour round trip it may take to see me. So home visits have come back in a different way. Next slide, please. Sorry, no, back. But also, you know, as I've learned about happiness and the action for happiness, which Anthony is a patron of, and I think that is, are patients happier? Now, I'm not going to deny that, you know, the group of patients I work with may be privileged, etc. But there is a general theme that they perhaps feel happier, and yeah, they're not having to go into work. They're spending time at home, spending more time in their relationships, etc. So there is a general feeling. I'm not going to deny there's a lot of unhappiness out there, a lot of awful situations, and so many awful situations if your family's been affected by the COVID, and sadly there's awful over 40,000 deaths, horrendous. There's a lot of unhappiness, and I'm going to come back to an example of that in a minute. There's a lot of unhappiness, but through this there has been some degree of happiness. Next slide, please. So if we move on in harmony, the A, active in mind and body and acceptance. So how is this, what we learned, next slide please, from COVID, from this? A lot of people are doing more exercise, but they're leaving the gym. They can't go to the gym, but they're doing walking. And there's a fantastic book by Shane O'Hara about In Praise of Walking, how not only is walking good cardiovascular, good for muscle strength, but is also good for the mind. But also more and more people are cycling, and I hear that the number of bikes being purchased has increased by about 50%. But also what is happening, and that's what we've got to be careful, and now there's going to be needs for county councils, etc., because there's been a big increase in the number of accidents, and I think cycling lanes have to be looked at, fine in cities, but going on country lanes, etc. But we're looking at the benefit of exercise, but keeping it simple and perhaps encouraging people to do more exercise if they can outside when they are allowed. Yeah, lockdown, this is sort of post the lockdown era. Next slide. But how did it affect me? This is this is my mother, who sadly died 2 days before we were all locked down. No, sorry, she died 3 weeks before we were all locked down, but her funeral was 2 days before lockdown. She didn't die of COVID, but we were going to have the funeral in Wimbledon Church there, and it was going to have all her friends and family and relations there. But because of COVID, we had to cut it back, and we had to have a small service with just immediate family in the local cemetery. But it was exactly what she wanted. It was simple. And she always used to say to me in her last year, she was 94, 5 when she died, she'd always say to me in the latter years, Michael, we've got to, she said, we must do what I'm not good at, which she's not good at, to learn to accept and be content. And sometimes I think we've got to accept and be content, control the controllables during this horrendous time for some people. Next slide, please. But also what I use now a lot for my patients, because there is stress, there is grief around, and also dreadful loss, that to do what Gandhi says, you know, have a day of silence. I don't tell my patients to do a day of silence, but I often say to them, I'd like them to give me 3 minutes of their life per day, and just sit in a chair and have 1 minute silence 3 times a day, or go for a 5-minute walk in silence. And I'm talking to patients about this, and they're embracing this and finding this very positive time to do this, because they do get stressed. Next slide, please. So then we go on to the R, resilience, self-control, reflection. And I think that's so important. We've got to have resilience. We've got to build it up with self-control, self-efficiency, and self-esteem. Next slide, please. And I'm just going to share some of the the comments that I've heard and read during this time of COVID. And Anthony, you and I talked about Lord Moran, but in his book about the Second and First World War, he said, men were out in war like clothes. Courage and willpower are limited in stock. And I think that's so true in this time, that it's easy to put on a brave face, but sadly there have been lots of personal and public tragedies, and one's got to give time to reflect about these and allow grief. And I often talk to this about patients of mine, to two patients of mine, to allow the grief, but then to try and celebrate. These are comments that I've used and gained. Celebrate the things that have not changed and make them key components of mainly normality, and part the panic. But I think the most important comment I'm thinking of about COVID and what I've learned from COVID, in the rush to return to normal, consider which parts are worth rushing back to. In the rush to return to normal, consider which parts are worth rushing back to. But I have this awful fear. I'm sure it's happened to none of you who's listening, but I will admit myself that occasionally when you have a hangover, you wake up and you say, I'm never going to drink again. And you quickly forget. And I think that's what we've got to be careful, not to forget the lessons we're learning from COVID, and to keep on using them in our future life. Move on, next slide, please. But also we've got to give patients choice. And I'm a great believer and a fan of evidence-based medicine, but evidence-based medicine is more than what it's actually made out to be. It's made up of three components. It's what the relevant scientific evidence is, what the clinical judgment is, but also is taking into consideration the patient's values and preferences. And I think with COVID, it's allowed me to sort of self-reflect that we've got to be looking at evidence-based medicine, but evidence-based medicine in practice. And part of harmony is to make a good diagnosis, to review all the options that are available, to discuss those with the patients, to then agree on a policy that is acceptable to the patient and implement it and then follow it. Sometimes I think we use evidence rather than looking at what is the evidence, but what does the patient want? Next slide, please. Then we're moving on. Harmony, medicine beyond pills and procedures, and membership of society. And that's the M part of harmony. And has COVID added anything to this? Next slide, please. And I think it has in a huge way. One, sadly, is demonstrated the huge inequalities we've got in society, from the inequalities, the people who get it, the inequalities in the financial situation, the privileged can cope with it. There's horrendous stories that you hear in the radio, hear in the news, and here in the local communities of people in running into dreadful financial problems. And also I've heard several people who from developing countries, their salaries have gone and they were sending money back to those countries. But I think also we're seeing the effect of lockdown, not only on the inequalities now, but later on, that we're going to get even more inequalities because prices are going to go up, the restaurants are going to go up, the cinemas are going to go up, theatres are going to go up. So we're going to get even a greater divide. So we've got to look at how we can prevent that from happening. I'm not a politician and I don't want to be a politician, but that's one of the things that, because we do know that inequalities leads to ill health, and we've got to prevent this, and we've got to give equal opportunities to all. Next, please. And from this, you know, what I've been working with a colleague of mine and embracing, although I mainly work in hospitals, but I think social prescribing is becoming in its forefront now within the communities, that recognise that people's health is determined by a range of social, economic and environmental factors. And social prescribing therefore helps address patients in a holistic way to help them and take control of their own health. So it's not all about pills, it's not all about potions. Next slide, please. Next slide. And from this, we've well, part of this is we have a College of Medicine, which I'm treasurer of, and Michael Dixon, who's the lead for social prescribing in the NHS, is chairman of, and moving the centre of gravity back to the patient is important. And I think that's what I'm learning from COVID, and don't go against the grain of nature, but help boost self-healing and we're looking at food, the forgotten medicine, exercise, the forgotten medicine, and I think sleep, the forgotten medicine. There's so much medicine out there without pills and potions. Next slide, please. But also what I have found quite fascinating from COVID is before COVID, we had patients who were on waiting lists for operations. And for obvious reasons, these were having to be cancelled. And it's something that I've been going on and on and on for a long time. And I'm only talking about gynecological operations. But I went to my trust board once and I said, I can cut my operation list by 20%. And they got really excited and said, how can you do that? I said, don't operate. A lot of operations, in my opinion, are unnecessary. In my area, diagnostic laparoscopies are probably, in a lot of cases, unnecessary. If we have good imaging techniques, and I never now do a diagnostic laparoscopy, we only do a therapeutic laparoscopy, so we do treatment. And indeed now, diagnostic laparoscopies are not allowed within the hospitals, where it's level 3, we may be allowed to do it in the future. But what I'm finding is a lot of patients on waiting lists, we discuss it, and they don't need their operation. We've worked it out a different way, and by not having the operation, the knee-jerk response can often be to operate, and now we can manage them in different ways. And this is, I always remember when, before COVID, I'd often say to patients, if you and I were living on a desert island, I'd say to you, just go away and do this and do that, and look at it in a holistic way. But we're not living in a desert island, let's do these tests. But now, because of COVID, I'm not able to do a lot of tests. I'm not able, and definitely not able to do operations. We can do some tests, and it's changed the way we're managing patients. Next slide, please. So what is the O of harmony? It's looking outside the box. Next slide, and that's what we are doing. We're challenging the system. Next slide, please. But we are doing things that I thought about in the past, but now is becoming acceptable. We're doing these Zoom meetings like we are now. We're doing Zoom meetings for management meetings, Zoom education meetings. And also what I'm doing is now we're doing my Zoom meetings, and if a patient needs tests, I can send them kits to their house, and they can do a finger prick, and they can drip some blood. I always want not to do it in their sitting room, do it in their bathroom, and they drip some blood in a little bottle, and that's then sent off by post, and we can get the results the next day. So they don't need to be using the resources, don't be using coming into hospitals, etc., to have all the tests. We can do a lot from home. And believe it or believe it not, and I'm not doing it myself, but there are places in Europe that are doing, is home ultrasound scanning. That you are lending the patient a scanner, and they can do for certain types of care, they can do scanning at home, and we can then monitor it on their iPhone, etc., and we can do that. So we are changing the way we're looking outside the box, and education programs that like this, and we're now doing education programs, and I spoke at the beginning about Dumfries House, and we're now doing education programs, team education programs with couples with infertility, with menopause, with chronic fatigue, etc. And we're doing Zoom calls. We should still have the group meetings, but we're doing it without all the traveling. Next slide, please. But it all goes back to teams, and I always think this is what I've learned about COVID and teams, because we all work in teams. And this was Eddie Jones from English Rugby saying, a team is like a tea bag. You only know how good it is. You don't know how good it is until you put it in hot water. And I'm finding with COVID and my teams, how good we can all suddenly, we have a common enemy, and it's a bit like sort of the Pearl Harbor of now we have a common enemy and we're now working together as a team. And that's what I've learned, the need for good teams. And I think if I encourage people in medicine, it's not an individual approach, it's very much a team approach. And teams are great, but put them in hot water and you know how good they are. And we're seeing that here. And personally, I'm seeing it in my teams, fantastic. Next slide, please, lead. So now we come on to the end of harmony, nature. And what has that taught us? Next slide, please. Well, we do know that the importance of nature in the hospital environment is there. And with COVID, we're seeing all these horrendous pictures of patients dying in loneliness, in intensive cares. But we do know that if we can bring nature into hospitals, if you have a window, and I'm sitting here with a beautiful view of my garden here, it is soothing, and we do know, and there's lots of evidence to show it, that bringing nature into hospital shortens care, shortens time in hospital, decreased medication. I'm not going to say that it improves COVID by any ways, but it can improve the whole experience within the hospital. Next slide, please. But I then was thinking about what I've learned and how what I have done during COVID, and I'm proud to show me on for the first time ever my rhubarb plant that I have grown during COVID. And I was thinking that this actually is what harmony is about, that it's got history. It had the history that rhubarb was used by the Chinese as a laxative, and then by the Romans and Greeks in many remedies. We then got the seed, and I then had to feed it and nurture it and water it and put it in the right position. And there's some evidence, no, not evidence now, but the benefit of gardening, if we can, on health. And this is what I've learned, that the new vitamin we should be having is a vitamin G, which is the role of gardening and how looking after plants, etc. You can see how harmony and health is so important. Next slide, please. And are we seeing birds singing or hearing birds singing more? And I don't know, I think we are, but I don't know, but it definitely had a positive effect on our environment. And I was on to a colleague of mine who I worked with in Delhi recently, and we were talking about that, and he feels, yes, the smog is gone from Delhi in where he was. But we've got to go back to what is the most important environment, next slide, that we all have lived in, next slide, is the environment of our mother's womb. And it's the effect of that. We know, and I spend a lot of time with my patients talking about the concerns about COVID and pregnancy. And we do know from the data we've got, but goes back to something we really don't know, but the data we've got, it doesn't affect pregnancy, but it does affect the journey. And people who've had babies in the past, now antenatal care has said to be completely changed and partners aren't allowed in, etc. But we do know that environment on the mother's womb can, and you within your womb, can have a huge effect for the rest of your life. And one simple, next slide please, example that this is pre-COVID, Nick, is the effect on sperm count. And we're definitely seeing sperm count going down over the last 30, 40, 50 years. And I've often said, is sperm count the canary of the past? That the canary that was down the mines was there to identify toxins and would either stop chirping or die. And we do know, and there's a friend of mine, a colleague of mine from Cambridge, who has been working with and dogs and moving them from the domestic environment back to the kennelled environment, etc., and looking at the effect of sperm. And there's definitely evidence that that toxins can have a negative effect on sperm. But one of the big things, and probably one of the biggest things I have noticed during COVID with my patients, and remember I do a lot of work with infertility, next slide please, is more pregnancies. we're having a lot of people who are conceiving naturally. Now, whether that's due to better food, whether it's due to less stress, whether it's due to better relationships, I'm not going to deny there has been a big increase in the number of divorces being sought as well. But that's not my area of work. My area of work is looking at fertility, and we're definitely seeing this. Or, and this is perhaps lateral thinking, or not lateral, is it looking outside the box slightly? Is it that we are going to see a decrease in environmental toxins, and is that having a positive effect on the sperm count? I don't know. Or is it, next slide please, that people are sleeping more? And again, going back to history, there's a fascinating talk by the head of the Benedictine monks talking about novitiates going into the monastery, and how novitiates, when they go in, because they change their routine, they're not in control of their routine, they all feel very tired. And I don't know whether you did, but I must admit, when I suddenly had to change my routine, I felt tired. And are we sleeping more? And we do know, another very good book, Why We Sleep, we are sleeping more. And I know again, certain people are not, but I think there is, some people are sleeping better. But we do know that sleep helps the immune system, that sleeping can get you in a stronger position and may help you be able to fight any viral infections. And if you don't sleep more than 6 to 7 hours a day, doubles your risk of Alzheimer's disease, increases your risk of cancer and Alzheimer's disease, heart disease, stroke. And there was this book with a very good article recently, one of the papers asking the question, why do we sleep? Why do we sleep? And it talked about all the benefits, and the answer came back and says, we're asking the wrong question. The question should be, why are we awake? Waking does the damage, sleeping does the healing. We'll talk about that later, perhaps. And finally, next slide, please, is yes, we've got to go through, and Harmony is giving patients their choice and what do they want. Next slide, please. So if we think, I think that before COVID, we were like a plane taking off. And then we got into COVID and we were sort of below the clouds. And then we are now, in my opinion, in the cloud. We're a bit confused. We're lost. It's uncertain. We don't know where we're really going. The future is above the cloud. I don't know where we're going. Is it east, west, north, south? I don't know. But can improvements in the inefficiency of the systems, the traveling of patients, decrease in the operations, looking at food, the forgotten medicine, looking at sleep, the forgotten medicine, looking at exercise, the forgotten medicine, be the silver lining to the cloud? Can we readjust and not rush back? But perhaps we've got to stop talking. We've got to help more, break down the social divide, give opportunities to all. We've got to, and this is where I think, Anthony, you're doing such a fantastic job. We've got to, it's a lifetime education, from educating the pregnant mothers to affecting the womb, to the old people like my mother, with acceptance and contentment. And again, not being a politician, but we've got to begin to influence the influencers. Next slide, please. But what I think COVID has taught us, and it doesn't matter how much I talk and how much harmony we talk about in medicine, there's one thing we are still missing, next slide please, is social interaction. That's what I think we're still missing, us being able to see our grandchildren or our children or our other relations, etc. And one forgets the importance of social interaction in health, in life, etc. I've always said medicine is a barstool subject. It's meeting the contacts over the bar, chatting about problems, ringing up your mates, saying, what would you do here? And that doesn't matter how much Zoom, how much meetings we do on Zoom and phone calls, etc. We still miss that social contact. So thank you very much. And that just gives you some idea of how I think harmony in medicine, which is my passion, we can use COVID and you try and create the silver lining to COVID. There's horrible, horrible, horrible times. Our local GP here died at the age of 59 from COVID, and other friends and relations of ours have had it. And I'm not going to, it's had awful impact on the economy, awful impact on lots and lots of people's lives, and will have for the rest of their life. But trying to be an optimist, we've got to have hope. There's grief, but we've got to try and have hope for the future. So, Anthony, thank you very much.
Thank you, Michael, very much indeed. And thank you to everybody. We have, we're in 3-figure numbers listening to you there, Michael, a great audience, superb questions. Do everybody keep the questions coming in. Welcome again if this is your first, welcome everybody, but particularly if this is your first such talk. You know, and Michael, the University of Buckingham is about challenging. I notice some medics are very uncomfortable at the notion that you should challenge their way of thinking, and they get very quickly very defensive about that. They should be positively looking for different ways of thinking, rather than reducing all natural health or harmony to thinking it's all about quackery. There was a really very ill-balanced piece by Dominic Lawson, normally very good in the Sunday Times, yesterday, misunderstanding what your patron, Prince Charles, is actually saying about this kind of healthcare. So easy to misrepresent. Let's go straight on to questions. And thank you for all of them. Maria says, would it be possible, Michael, for University of Buckingham medical students wanting to go into this field to spend some time with you and work on projects or research? Now, if I was could hear from Maria, I want to know if the field there is gynecology or what you're talking about with harmony, but just go quickly on both.
One, definitely yes. I think this is something which I go back in my last slide. We've got to spread the word. And go back to your comment there, and that's why it's so simple. We're not looking at witchcraft. It is so simple, and that's why you talked about sort of complementary medicines, but no, we can talk about exercise and diet and etc. But going back to I'd love to grow harmony in medicine. Yes, my expertise is gynecology, women's health, but I'd love to create a forum and a challenge to you, Anthony, a department within a medical school of harmony in health, because I think it crosses, yeah, I'm talking about women's health, but male health, I see that on the male infertility, and it goes across the whole spectrum. So very happy to talk to people, very happy to share ideas, but I'm not the world expert in it. I'm just wanting to get like-minded people around and I think create a potential fantastic movement for our patients.
And you're happy, Michael, everyone can see there on the screen. I'm not clear whether we're seeing a big picture of Michael here or of the final slide, but can you put up again, Mark,
that's
that
my
email
there.
People can see the email. Let's come on to Susan. What made you choose this field above other fields of medicine, Michael?
Well, it's interesting. I qualified in London at Charing Cross, and there's the painting of it there, somewhere there. But my other love was, when I talked about doing the Olympics, I was director of sports science and medicine for the equestrians. So I had a love of horses, and my wife lived in Ireland then. So I actually went over to Ireland to do general practice. And that's where I started doing general practice, but then created a love. I did my obstetrics, I did my gynecology, and I created a love for that. And then I went into research, hormones, etc. So I'm not denying it was sort of serendipitous. And my father had the tradition. He said, Michael, he said, opportunity is like a man with a forelock. And I do apologize, Anthony, I haven't had my hair cut for today, but I'm unable to get my hair cut. It is normally a bit shorter. But opportunity is a man with a forelock coming towards you. But if it goes past you, it's like a bald man. You can't grab it. So any opportunities arose, and I then went up to Galway and then moved over to Oxford. So opportunities arose, and I just feel the area that we're in, it's such an exciting area that we can do help from, the birth of a new child up to the looking after of elderly women, etc. So it's got a wide spectrum.
Lots of questions, Michael. To be as brief as you can manage while still answering their fascinating questions. Somebody's challenging you here about Socrates and how does not knowing help anybody? Not knowing. One second. Not knowing is not the power that is not letting us be curious and determined to know, to find out. That's what we should be doing. Finding out through research and science. No.
Socrates, Socrates was executed because he knew that he did not know. And I think that's half the time we've got to be honest and say 90% of what you're teaching your medical students now, by the time they retire, have been demonstrated to be wrong. So I don't think we can ever sit down on our laurels and say, we know it all. We don't know, and things have got to change. I'm saying I know that I do not know a lot of things. We may think we know, but a lot of times we don't know.
Do you think that COVID? Next question from Numa says, do you think that COVID-19 is going to have a positive or a negative effect on the NHS and on medicine?
I think it's going to have a huge impact on both. I think, sadly, the NHS is going to take a long time to recover because of the huge backlog of patients. And even now, there's a lot of beds empty because we can't operate on patients, etc. So there's going to be an enormous backlog for routine care. And a lot of people saying, oh well, the worried well don't need to be seen, but in the worried well there's a lot of unwell people, and therefore the diagnosis and treatment of cancers, etc., the people who need their hip operations, is going to have a huge impact across the board. But hopefully it, although I'm not sure always it needs lots more money, but I think it would help focus the politicians, because medicine and politics are so intertwined that it may help focus them a bit more.
Next question. Why do schools and universities not teach people how to live, how to eat well, how to sleep well, how to rest, how to be in harmony with their bodies?
Not being an educationist, I don't know, but I think, again, goes back to the conference you and I are at, Anthony. There's a movement towards a harmonic approach, and if you can see, there's a book, A Teacher's Guide, A New Way of Looking at Learning About the World by Richard Dunn, on harmony and health, on harmony and education, and it's the most wonderful way of looking at education. But it goes back to teaching the parents, to teach them to look after teach harmony at home, and then use it through schools, etc. So I think it's something we need to drive, and it's from your work, Anthony, that I think it's beginning to happen.
Can you teach people how to be? One second, question. To live healthily. It's fine for you to talk about obesity, but how do you help somebody who's already very worried and self-conscious about being obese?
And I think that's it. That, as I always say, that tell me and I'll forget. Teach me and I'll learn. Involve me and I'll remember. And I think you're right. It's not the worst thing is just to stand at a pulpit. One's got to lead by example. We've got to look at proper education programs, and going back to my area of work, that, you know, say anti-smoking, we know that teaching people and telling people to not smoke during pregnancy is far too late. We've got to learn and talk about it earlier on. So it's not just directing at the individual, it's directing at the whole of society and schools, etc. Education.
Nancy asks, which sector of medicine and healthcare would benefit the most from initially prescribing exercise and better diet?
Oh gosh, it's just across the whole board, isn't it? I can't think of a sector that, you know, it's good for mental health, it's good for physical health. I can't see one sector. I'd answer it the other way around. Which sector wouldn't I offer it to? And I don't think I could think of one.
Are mental and physical health really separate or the same?
They are. They work together, and that's why I think it's a holistic approach to medicine. That, you know, walking is good for mind and body. There's so many things that can be involved with care that why separate them? They're all together. That, you know, if you think, there's a friend of mine who had a COVID test that has turned positive, but it's caused so much mental trauma to her that the decision should have been questioned, should she have had the test. I won't go into the reasons behind it, but any test we do can have both physical and mental implications. If I do a screening test for cancer, that can have huge mental as well as physical implications.
On diet, somebody's wanting to pin you down a bit here, Michael. What are the things that we should be doing more of in our food and drink, and what should we be doing less of?
Well, one thing I always say about, again, keeping it simple, and I'm not one to give lots of good things and bad things. I do think, and one has got to be careful about elitism again and looking expensive. Food needn't be expensive, but what I do think is that the quality of food is important, but what is probably even more important is the food that the food eats. So I am talking about quality of food, which needn't be expensive food, but good quality food is as important. So what was the question again? So that's one point of keeping it simple.
So the types of food and drink, the things that we should be having more of, and the things you think we should be having less of.
Well, I think that, yeah, if one, the refined sugars one needs to be careful of, too much alcohol one needs to be careful of, obviously smoking one needs to be careful of, but also, as my father's upbringing says, the purpose of life is to be good, not very good, and not all the time. So I think one's also got to enjoy yourself. But I think, you know, local produce, home produce is the type of food one needs to be. Good, solid, basic food.
Natural. Zara says, I love the idea of bringing nature to hospitals for staff and patients. My question is, what new methods of healthcare delivery would you personally like to see integrated post-COVID, i.e. aspects of diagnosis, self-management, etc.?
Just ask that question again.
So Zara's wondering, what new methods of healthcare would you like to see integrated post-COVID? For example, aspects of diagnosis, self-management, etc.
I think, again, I'm very excited about the introduction of social prescribing.
And just explain that again, Michael, for those who don't know.
Well, it is in some way. I think, again, we perhaps made it complicated. It's the old GP in some way, that the old GP would talk to you about diet, but now there and exercise. But social prescribing, there will be nurses within practices that will then help identify, you know, perhaps the gyms or the walks. We've introduced one up in Scotland where we have tea dances for 150 elderly people over, I can't remember exactly what age, but they come and they have a tea dance. in the evening, only at about 6 o'clock in the evening, and they have an Elvis impersonator, and that brings community spirit, and that can do more than potions and pills. So it's using society, and you can have gardening classes, and they may want to do gardening classes, or now maybe have to do Zoom gardening. So it's using the community to help health, bring it all together. I suppose one area I'm still fascinated about, I'd like to bring primary and secondary hospital care and community care and primary care much more working in synergy.
Numa says, and we've only got 3 minutes left, in what other ways can we encourage harmony in healthcare? The protests currently happening surely demonstrate the lack of harmony across the country.
I mean, I was going to mention that the protest, I think, is, it's so sad that we're still in a, it shows the inequalities, both social and perhaps racial. So, should we go back to John Lennon's Imagine? And is that, he doesn't actually, I looked at the words before this talk, he doesn't mention word harmony in it, but a lot of what he proposes, but that's a huge political decision, perhaps not above my skills.
The role of faith, Michael.
I'm a believer. I think faith is important. I spent a lot of time going around the world looking at different types of medicine, Ayurvedic medicine, Unani medicine, and I'd love to learn more about different faiths. I personally think faith has an importance. If nothing else, it provides a community. It provides contact. So I think faith is important.
Mark says, do you think not having interaction and seeing the patient in person could lead to misdiagnosis, or do you think online visits are offer a more personal service and the patient benefits from that and being able to stay in their own home? So that's
I think again, it's a new skill. I mean, giving a talk on Zoom is a new skill, and I think we have got to be retrained in giving lectures on Zoom, and I think we've got to be retrained. Yes, I've no doubt that I always, in the old days, when I'd see a patient, I'd go out to the waiting room, and the way they walked in is so important. You could monitor them, and it's something that we use for animals. If we were at Royal Ascot this week, or it's this week, isn't it? And we're at the parade ring, we'd say, oh, that horse is in good condition. So that's no doubt the eye and looking at patients is so important. So I think Zoom, to me, is not better, but it's a good second best to seeing the patient. And I think, again, the skill to be able to use diagnostic tests as and when necessary. And
finally, was the herd immunity policy based on evidence-based medicine, and how has the pandemic affected the treatment of other diseases, because people have not been able to get the same exposure to medics?
Oh, I think the herd immunity, again, is not my area of expertise. I think it's an interesting concept. I think I'm pleased to see we're not getting that second wave that I thought we would be, but we may get it in a few months' time. I do fear that because of COVID, as I go, a lot of people, casualties were down 50–60%, and sadly, I'm sure a lot of people have suffered from other illnesses that they've been afraid to go to their doctors for, and this is the sort of thing that's going to come out in the wash. And I think we've got to learn from this pandemic how we're going to handle the next one, because there will be a next one.
Kelly says, do you think cybersecurity will be a problem for online meeting patients?
I think that's very important. Again, I've learned from it. I think as we're using here, Microsoft Teams may be slightly better than Zoom, and there's probably another one. And I use techniques that I always have a waiting room. when I see, so the patient has to come into a waiting room on Zoom, and then when they get in, we will lock the meeting. So there's two methods of security, but I think sadly, yes, there's always going to be that problem. And GDPR, as is present in medicine at the moment across all areas of life, it needs to address Zoom and other forms of interaction.
Final question, give us one piece of advice, Michael, all of us, to help us through.
Grieve the past, but keep positive, because the future, have hope for the future, because I think there's a lot of exciting things that we'll learn from this. That I'm not going to deny there'll be some awful, awful, awful experiences, but hopefully those people that died, they will leave a legacy for the future. Have hope.
So before I thank Michael, very quickly, 30 seconds left, can I just say that we have on Wednesday Philip Pullman, on Thursday Martin Stern, who was in Amsterdam with Anne Frank and the family and went on to the concentration camps. We'll talk about that. And then next week the speakers include Henry Marsh and also Julia Samuel, who is a great expert on grief and coping with loss. Michael, that was a sensational, fascinating talk, challenging but encouraging also. Thank you so much. And the whole community is giving you a virtual hand clap. Michael Dooley, from us all at the University of Buckingham and our community here, heartfelt thanks.
Thank you very much for having me.